ang Doctors on TV. Mga kasambahay, Sight Saving Month this August, kaya ang topic natin this morning, eye care. Panoorin muna natin ang video na ito.
Our eyes are the windows of our soul. Isa ito sa mga pamilyar na quote na nagpapakita ng kahalagahan ng ating paningin. Kaya nararapat lamang ingatan at pangalagaan ang ating mga mata. Kaya naman patuloy ang malawakang kampanya sa publiko ng Department of Health, katuwang ang mga espesyalistang doktor sa mata, na ugaliing magpa-check up ng mata upang mabawasan ang tumataas na bilang ng mga pasyenteng dumaranas ng problema sa paningin at pagkabulag. Taon-taon ipinagdiriwang ng Department of Health ang buwan ng Agosto bilang Sight Saving Month, na may layuning maiwasan ang mga eye problems at mabigyan ng mas malawak na kaalaman ang publiko sa tamang pangangalaga ng kanilang mga mata. Batay sa datos na hawak ng DOH, mahigit kalahating milyong Pilipino na ang dumaranas ng problema sa paningin. Halos 2 milyon naman ang may malalabong mata, dulot ng iba't ibang factor. Kabilang sa pangunahing sanhi ng pagkabulag ay ang katarata, glaucoma, at age-related macular degenerations. Pag-aaralan natin ngayong umaga ang iba't ibang paraan at gamutan para mapangalagaan at mapanatiling malilinaw ang ating paningin. Kasama ang mga expert, Doctors on TV.
A witness to
And topic natin for this morning, of course, we've invited a very special guest, an old friend of UNTV. He always guests in our program and other programs here in the station. To introduce our guest, Ms. Gretch.
Yan, ang ating guest for today is si Dr. Vicente Santos. Yan! Actually, siya yung isa sa mga favorite doctors ko na gina-guest natin. Siya ay isang LASIK eye surgeon, an ophthalmologist and retina specialist. Presidente po siya ng Fatima University Medical Center at isa siyang section head ng cataract and refractive surgery. Ladies and gentlemen, Dr. Santos. Hello po!
Hello!
Good morning! Good morning,
Good morning, Jim.
Welcome back.
Good morning, yes. Thank you for having me here. I'm so
President ka
glad.
na pala, sir, ng Fatima University, sir.
Oo nga, lume-level up si
Yeah.
Dr.
Dapat lang. Kasi kapag magaling ka, talagang nagle-level up.
Thank you so much.
Congratulations, Doc.
So, Doc, ang specialty mo, ophthalmology o yung mga mata natin. Nabanggit kanina, the windows to our soul.
Yes.
Okay, let's start with the basics, Doc, ha?
Yeah.
Ano bang usual anatomy and physiology ng mata natin? How does it work po?
Well, the eye works by receiving the light into the retina, and then the image is transmitted to the brain.
So, parang camera lang yan.
Parang camera lang yan.
Camera.
So we look with our eyes, but we see with our brain.
Okay.
Ngayon, ang topic is refraction. It has to be seen clearly, no? So dapat yung rays of light are focused into the retina at the exact point, at the same level that the retina is there. Otherwise, we have what is called an error of refraction. Yun yung nearsighted, farsighted, presbyopia, astigmatism. So all of that contributes, no, to the blurring of vision.
Okay. And it's the lens, no? So, parang camera din, meron tayong lente na kailangan trabaho niya i-focus yung ilaw.
Yes, but it's a
Like
system. It's a system of lenses, not just one lens. It's the cornea, the fluid inside the eye, the aqueous and the vitreous, and the lens. All of them are working together like a whole lens system. Pero
Okay.
ang end result dapat naka-focus o naka-pinpoint siya sa retina.
So, parang SLR talaga.
Oo.
SLR.
May mga iniikot
Hindi lang
sila,
simple yung
ganun.
camera ng cellphone, kundi talagang complex na
Complex
malaking
siya.
camera.
Several,
Mga gumagano
yeah.
And many things can go wrong along the way. From the cornea to the lens.
Yeah, anything can go wrong. No? There can be an opacity, cataract, vitreous hemorrhage, corneal scar. Pero kung clear yan at hindi lang focused, yung focus ang maayos. And that's why we're here. We're here to talk about refractive surgery.
Okay.
And the latest refractive procedure that is now available in the Philippines. It's called SMILE.
I like that one.
Okay.
First thing that you do in the morning is SMILE. Ayan, tingnan natin mamaya kung bakit
So,
ganyan.
nakita pala may pinakitang anatomy ng mata. So,
Yeah.
orient us po, no? So, saan po yung galing ilaw and then where does the
Oh, the light.
Ito.
retina?
Okay, I use my finger. Okay, the light
Pwede po,
comes
sir.
from outside and then it is bent here. No? Refraction simply means bending of the light.
Okay.
So it gets bent at the cornea, then further gets bent through the aqueous humor or the fluid inside the eye, and then it gets further bent by the lens, and then another refraction with the vitreous gel. And finally,
2, 3, 4.
it hits the center of the retina called the macula.
Macula.
Okay.
Okay, and the macula has axons, no, or fibers which gets transmitted into the optic nerve.
Okay.
Kumbaga electricity, yan yung transmission line, no? So it gets transmitted into the brain where it's interpreted as an image.
And where does error of refraction occur now?
It can occur here or here, at the cornea or the lens. And there are several strategies of correcting error of refraction. One is, you change the light itself. So, lagyan natin siya ng lens para ayusin mo na yung rays of light at para mag-sentro siya. Glasses ang tawag dyan, no? Or contact
Yung
lens.
salamin natin.
You can change the shape of the cornea. I'll go into that later. Or you can change the power of the lens through a surgery. Pero yung topic po natin ay changing the curvature of the cornea to correct
okay.
the grade.
Bakit, Dok, nagkakaroon ng problema yung pag-refract niya habang tumatanda yung isang tao especially?
Yeah, pag tumatanda po ang isang tao, meron pong kakayahan ng ating lens to change its shape, to accommodate, or you call it accommodation, to actually focus the light by seeing something near, no? So, pag nakita mo malapit, nag-change siya. Automatic.
Automatic.
It's automatic. It's an autonomous reaction.
May autofocus.
So
Okay,
gaganyan po ang
autofocus.
ating lente at yung rays of light mafo-focus mas sharply and then you see it clearly. As we get older, medyo tumitigas na. Tumitigas na ang ating lente. Mga parang parang
Buto
joints.
natin, oh.
Hindi na kasi we're not as flexible anymore. Pag medyo
So, hindi siya maiwasan? Ibig sabihin, Dok, ganun?
hindi siya maiwasan. So actually, kung hindi niyo sinasabi ang edad, mahalata yan pag nagsa-cellphone na palayo. Nauubusan na ng kamay.
Non-space.
Nawala na ng kamay, hindi pa rin na.
Selfie pa.
Hindi, tayo, ganyan pa tayo, eh.
Pero hindi nakikita.
Kunwari lang.
Kunwari lang.
Kasi sabi niya, pag nearsighted, basa nila yung malapit.
Nababasa nila malapit, pero malabo sa malayo.
Pag iba naman, farsighted.
Oo.
Maganda sa malayo,
pag
pero
malapit.
ito ilalayo na natin.
But some people, nung bata sila, farsighted sila or nearsighted, and then pagtanda nila, nagbabago yung...
Opo,
Nababalik siya.
nababago po yun. Dahil minsan pakapal yung lente. The shape of the cornea also changes. The axial length, no? Yung mismong laki.
Okay.
Yung mismong laki ng eyeball, nagbabago konti po yan. So all of that are contributing to
No?
blurring of vision.
Gaano ba dapat kalapit o gaano kalayo dapat ang pagbabasa ng normal pa na mata?
Ang normal na mata po, ang standard sa ophthalmology as a measuring device is about 14 inches.
14 inches,
14
isang
inches.
pulgada halos.
About a foot, a bit
foot.
more than a foot. Yun ang basihan, no? Pero some people, through force of habit, talagang nasanay na mas malapit at mas malayo. So we don't dictate the reading distance. So for example, we want to change anything with the patient. We let them have a magazine. Paano nyo po binabasa? Tapos ina-adjust po namin ng grado according to the way they're doing. It should be that we serve the patient and the patient serving a standard.
Yes.
Dapat ganun palagi.
Oo, parang customized.
Customized, yeah. Customized.
Dok, may
yeah.
question ako. Aside from like near and farsightedness, ano pa po yung ibang mga common ailments when it comes to sa ating mata?
Napakarami po niya, no? The most common is cataract, error of refraction. Error of refraction is not considered a disease, though, because napaka-common yan at wala naman po talagang diferensya ang mata, no? Yung kanyang setup lang, no? Either malaki o sharp ang pagkaka-curve. No? But other serious diseases are glaucoma and diabetic retinopathy. Nabanggit nga ni Dr. JM. Actually, we're in the same hotel when we launched our Smile on, I don't know if you were there on Friday already.
Ay, wala po.
I think you were there Saturday, right?
Yes, sir, last night.
Last night. So, doon din kami nag-launch po. And UNTV was there to cover
Oh.
the event. The launching of
Kaya,
Smile.
Oh. Dok, parati ko na narinig, astigmatism.
Yes.
Ano ba yung astigmatism?
Astigmatism, if you imagine that this is one plane, no? One plane, vertical. There's also the same grade on the horizontal level. And minsan, the degree of refraction from one plane is different from another. Hindi po siya pantay, no? So, in other words, may focus ka sa vertical, sa horizontal, hindi ka pantay. May error of refraction ka. Pag hindi siya pantay, it's called astigmatism.
ano naman ang nararamdaman ng isang tao, Doc, na may astigmatism?
Pareho lang, malabo. Malabo rin, malabo. Kasi
Yung pagkahilo, kasama ba yon sa
Ah,
mga symptoms ng astigmatism?
maraming causes ang pagkahilo. You're an endocrinologist. Isa na dyan yung high blood pressure, low blood pressure, high blood sugar. There's so many, no? But yung pagkahilo per se is not an ophthalmic...
Necessarily, no?
Not necessarily,
Although minsan gut reaction kasi ng
Ay.
patient na dumiretso
Patingin sa...
ophthalmologist.
Yes.
Pag nahihilo.
Oo, bago tayo mag-usap
Immediately,
ngayon,
no?
cut ko muna kayo Pero napaka-importante ng ating discussion ngayon. Pero bago tayo magpatuloy, panoorin po muna natin ang Naturally Yours about nutrition for healthy eyes and vision.